I'll be talking about covert brain infarctions of infarcts, and these are lesions found on neuroimaging, and often performed in patients not for strokes or for other diagnoses, and they're quite prevalent. So these lesions can be found quite often in elderly, healthy populations, and especially in population at risk, you find more often this kind of covert brain lesions. And they can be subtyped based on location and size, and they could be small lesions, small lacunes, or they could even be a bit larger, infarctions or even cortical infarctions. And I'll also be talking about their association with cognitive impairment, their associations with cognitive decline, with stroke and dementia. What we recently did is a study performed in sporadic small vasculitis in about 53 patients. And we scanned them monthly with MRI scans, and we investigated how often recent small subcortical brain infarctions can be found. And these are small diffusion-weighted lesions located throughout the brain. And we found in about 70% of the patients have these lesions, and they are not associated with any clinical symptoms. And some of the lesions, they evolve into white matter hyperintensities, in lacunes, microbleeds, but most of them, they disappear in the follow-up scans. Other studies have found that finding these lesions, and this we have found also in our small vasculitis research, is that they're associated with a greater cognitive decline, with dementia, even with stroke and mortality. In terms of covert brain lesions, it really depends on the underlying etiology. And this has not been studied heavily as in symptomatic brain lesions. But there are several risk factors that are associated with covert brain lesions and with cognitive impairment. Age, for example, but also the vascular risk factors, mostly with hypertension. So it's quite vital to diagnose and treat the hypertensions. But there are other risk factors as well, like atrial fibrillations or after cardiac surgery, and they are associated with covert brain lesions as well.